Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's understand the antiplatelet drugs. So we look at the antiplatelet drugs and we also look at the classification. So antiplatelet drugs and their classification. So first to begin with, first is the cyclooxygenase 1 inhibitor. So cyclooxygenase 1 inhibitor. So cyclooxygenase 1 inhibitor, the drug here is nothing but the aspirin. Next is the irreversible P2Y12 inhibitors. There is the irreversible P2Y12 inhibitors. So this is nothing but the ticlopidine, clopidogrel as well as a prasugrel. So it is the ticlopidine, clopidogrel as well as the prasugrel. So antiplatelet drugs, cyclooxygenase 1 inhibitor, there is aspirin, irreversible P2Y1 inhibitor is a ticlopidine, clopidogrel as well as a prasugrel. So this was about the irreversible P2Y12 inhibitors. Next we move on to the reversible. So this is the reversible P2Y12 inhibitors. So this again it contains a ticagrelor as well as a cangrelor. So there is the grelor which is present in the reversible. Next moving on to the G2B. So we have the GP2B as well as a 3A. GP2B and the 3A inhibitors. So GP2B and 3A inhibitors, there is a abciximab as well as the FT-fibatide. So FT-fibatide, abciximab. Next is the tirofiban. So GP2B and 3A inhibitors, the abciximab, FT-fibatide and the tirofiban. So all this comes under the GP2B and 3A inhibitors. Next moving on to the thrombin. So we have the thrombin PAR1 receptor antagonist. So here the drug is the thrombin PAR1 receptor antagonist is going to be the vorapaxar. Next moving on to the phosphodiesterase inhibitor. The phosphodiesterase inhibitor is a dipyridamole. So it is a dipyridamole. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.